Welcome to the deep dive. Today we're looking into something you might have heard of, maybe seen. It's often called cherry eye in pets.
That's right. It sounds a bit odd, but it refers to a specific condition, a prolapsed gland of the third eyelid. Happens mostly in dogs, sometimes cats.
Third eyelid. Okay, so pets have an extra eyelid.
They do, yeah. It sits in the corner of the eye, usually tucked away, and there's a small gland attached to it, one that produces tears. Normally it stays hidden.
But with cherry eye,
Right.
it doesn't stay hidden.
Exactly. The little ligaments or tissues holding it in place are, well, sometimes they're a bit weak from birth, so the gland can actually prolapse or flip out from behind that third eyelid.
And that's when you see
That's when you see it. It looks like a small, round, reddish mass, like a little cherry, hence the nickname, right in the corner of the eye.
Okay. And you mentioned dogs mostly. Any particular kinds
Oh.
or ages?
Yeah, it's definitely most common in young dogs. Think 6 months to maybe 2 years old. And yes, certain breeds are much more susceptible.
Such as,
Oh, Cocker Spaniels, Bulldogs are classic examples. Beagles, Bloodhounds, Lhasa Apsos, Mastiffs, Shih Tzus, quite a few actually. And interestingly, a lot of the brachycephalic breeds the ones with the shorter noses.
right, the flat-faced dogs. And cats, you said sometimes.
Very rare in cats, really.
Yeah.
But if you do see it, it might be in breeds like Burmese or Persians. Much less common, though.
So for owners, what are the signs we should, look out for? Obviously, the red bulge.
That's the big one, yeah. That oval pinkish red lump appearing suddenly. It can happen in just one eye or sometimes both.
Anything else that goes along with it?
You might notice more tearing than usual, what we call epiphora, or the white part of the eye, the conjunctiva. Might look red and inflamed. Sometimes the eye looks sore, maybe some squinting blepharospasm.
And can things like dust or wind make it worse?
Yeah, definitely. Environmental irritants can certainly aggravate it, make the swelling and redness seem more pronounced.
Okay, so we see this. We know the gland has popped out because of this inherent weakness. What's the next step? What's the recommended approach?
Well, the crucial thing is preserving that gland's function. So the preferred treatment, really the gold standard, is surgery to put the gland back where it belongs.
Put it back, not take it out.
Absolutely.
Yeah.
There are surgical techniques, like the imbrication or pocket technique, designed specifically to reposition and secure the gland back under the third eyelid.
Why is keeping it so important? I mean, it's causing a problem, right?
It is causing a problem by being out of place, but the gland itself is vital. It produces a really significant amount of the tear film estimates range, but maybe 30 to 50%.
Wow. Okay. That's a lot.
It is. And if you remove the gland, you dramatically increase the risk of the pet developing chronic dry eye syndrome later on, keratoconjunctivitis sicca, or KCS.
Which is a whole other serious issue.
Exactly. Chronic discomfort, potential damage to the cornea. It's something you really want to avoid. So saving the gland is key.
Makes sense. Are there other things that could maybe look like cherry eye but aren't?
Good question. Yes, there are a few differentials. Sometimes the cartilage of the third eyelid itself can bend or evert, especially in certain large breeds like Great Danes or Weimaraners. That can look a bit similar.
Okay.
And much less commonly, especially in an older animal, you'd have to consider the possibility of a tumor on the third eyelid. That would need a biopsy to diagnose. Also, sometimes orbital fat can prolapse forward a bit.
Right. So the vet needs to make sure it's actually the gland.
Precisely. Diagnosis is usually based on the classic appearance, age, and breed, but ruling out other things is important.
And after the surgery, the tucking back surgery, is it usually fixed for good?
Often, yes.
Mm-hmm.
But there is a recurrence rate. It can vary maybe somewhere between 5 and 20%. It seems to be a bit higher in some giant breeds like Mastiffs.
So it might pop out again.
It might, unfortunately. If it does, sometimes a second surgery is needed. And it's also worth knowing that if a dog gets cherry eye in one eye, there's a decent chance the other eye might develop it later on, too.
Okay. So something to keep an eye on, literally.
Yeah.
All right, so wrapping this up then. The main takeaway seems to be cherry eye is basically that tear gland popping out due to a weakness it was born with, common in specific young dog breeds. And because that gland is so critical for tears, surgery to put it back is really the way to go to avoid dry eye down the road. Removal is generally not advised.
That sums it up well. Preserve the gland function whenever possible.
And be aware it could potentially recur or show up in the other eye.
Correct.
It really makes you think, doesn't it? This one little gland plays such a huge role. What other seemingly tiny parts of our pet's anatomy have these incredibly vital functions that maybe we just don't fully appreciate yet? Definitely food for thought about their amazing biology. Thanks for this deep dive.